acute respiratory distress syndrome.
Acute respiratory distress syndrome, also known as respiratory distress syndrome or adult respiratory distress syndrome, is a life-threatening reaction to injuries or acute infection to the lung. ARDS is a severe lung syndrome with direct and indirect causes. Inflammation of the lung parenchyma leads to impaired gas exchange with systemic release of inflammatory mediators, causing inflammation, hypoxemia and frequently multiple organ failure. This condition has a 90% death rate in untreated patients. With treatment, usually mechanical ventilation in an intensive care unit, the death rate is 50%. A less severe form is called acute lung injury. ARDS formerly most commonly signified adult respiratory distress syndrome to differentiate it from infant respiratory distress syndrome in premature infants. However,
is a group of diseases that affects the lungs and the airways, worsening progressively and limiting the ability to breathe. It includes conditions like chronic obstructive bronchitis and emphysema. Respiration is a process by which oxygen is taken in and carbon dioxide is expelled from the body. This function is performed by the respiratory system.
Within 2 days, the patient's lungs will show a whiteout on chest X-ray. This means that they are in complete distress and not functioning properly. ARDS is always a critical medical condition that requires a team of health professionals. Patients always require mechanical ventilation, which leaves the body vulnerable. Complications are quite common and often deadly with ARDS patients. These complications can include sepsis, hospital-acquired infections, and multi-organ failure. Patients can be hospitalized for weeks, often months.
A right-sided tension pneumothorax in less aerated lungs indicating worsening of RDS. We call it tension pneumothorax because the mediastinum is pushed towards the left hand side and the collapsed lung is visible here. So this is free air into pleural cavity, which is known as pneumothorax.